Hi, I'm Kushi. This is my sterile wound care video. I'm going to start by performing hand hygiene and then donning on some clean gloves. We also have a garbage set up down here, and the bed and table have been raised to my working height. I've already gathered all the materials necessary to begin. I'm going to start by preparing my field. I'm going to place the soaker pad right under the wound, as well as the basin, just to catch any drainage or any leakage that may happen. Next, I'm going to carefully remove the dressing that has already been placed. I'm going to examine for any discharge. I see some pink and some white, so we're going to say that's white serosanguinous. It's light drainage. Next, I'm going to take off my gloves, perform hand hygiene, and continue with opening my dressing tray. So we're going to open it from the perforated edge, making sure that there isn't any breakage in the tray. I'm just going to quickly set up a second garbage here using some tape.
So first I wash it until I take the doctor's order for irrigation.
So the garbage has been set up. I'm going to open the dressing tray, only touching the contaminated border, opening it away from my body, making sure that I'm not touching any of the sterile edges. Here is my transfer forceps. I'm just going to hold onto it, and again, only opening it from the contaminated border. I'm going to square it off and keep the forceps on the inside. Next, I'm going to start by moving things into my sterile field. I'm going to open my scissors using the banana peel method, grabbing my transfer forceps, and I'm going to place the scissors in. I'm going to toss this into the garbage. I have my packing strip here. We're going to open it upside down. I'm going to pull the amount that I'll need. That looks good. Use my scissors to cut them out.
I'm going to be measuring my
Dropping the scissors inside. Next, we're going to put our syringe into the field. We're going to banana peel the syringe, not touching anything inside, just using the transfer forceps to put it inside our field. Tossing this into the garbage. Grabbing our blunt needle. Banana peeling.
and I'm also checking for
Using our transfer forceps, placing it inside, garbage. Next, we're going to pour our normal saline solution in. Because it's an already open bottle, we're going to have to lift a small amount.
I will use this as a measure.
And then pour however much we need into the tray. Next, I have my abdominal pad in here. I'm also going to put this into the sterile field. We're going to start by banana peeling it, taking our transfer forceps, putting it in. I also already have some 4x4s and 2x2s in here that already came with the packaging. I'm going to toss this into the garbage. I'm going to perform hand hygiene one more time before I put on my clean gloves. Now we're just going to measure the wound. So what I'm going to be using is a Q-tip applicator that I have. I'm going to banana peel it, fold the ends, toss this into the garbage here. I also have my measurement tool, and we're going to be using the transfer forceps to take out the already there packaging. So I'm going to take this. This goes into the garbage as well as the transfer forceps. Now we're going to use the Q-tip applicator to check the depth. It looks about 3 centimeters. We're going to check the length. Looks about 10. We're going to check for some undermining or tunneling as well. Undermining or tunneling. Okay, we're gonna toss this into the garbage, and our measurement tool will be placed over here. I'm gonna don off my gloves using proper technique, and then perform hand hygiene once more. I'll also just move these out of the way because we no longer need them, so I'll place them behind me. Here too. I'm just gonna move this a little bit on the side. Now we're gonna be opening the sterile gloves. Okay. I'm gonna start with my dominant hand, making sure that I only touch the cuff. I'm gonna place my hand in. And only touching the cuff prior to bring it down. I'm gonna go in from the cuff for my left hand. Okay, like that. And I'm just gonna keep this on the side here. Now we're all sterile and we're ready to begin. I'm gonna start by taking my syringe and putting in my blunt needle to draw up my irrigation fluid. I'm just going to draw the amount up. And we're going to irrigate the wound. So by going in a zigzag pattern from top to bottom, we're going to irrigate the wound.
First step before you start anything. Make sure
From
your
top
tables
to
at adequate
bottom.
level and your bed is at adequate level. 2. Make sure that you have all the supplies you need for your sterile field. Also, I'm going to be performing hand hygiene when I do all these
The wound has been irrigated.
My sterile gloves.
I'm going to cap the needle.
20 ml syringe.
We're going to keep it on the side for now. Next, we're going to grab our 2x2s and dry the wound.
Because once you open your sterile field, you can't take off your gloves and do that. So
we're going to go one wipe on the side. This goes into the garbage. One wipe on the side. This goes into the garbage. And our last wipe is for the middle. This goes into the garbage. I'll just do one last one for the middle into the garbage. I'm going to keep this in the garbage as well. I don't need it anymore. Because next we're going to be packing the wound. So for packing the wound, we have these forceps. I'm going to take my ribbon gauze and we're going to dip it into our normal saline solution. I'm going to start by wrapping the gauze around the forceps.
That's there. We can start setting up the sterile field. So when we do that, we're going to be moving it.
And we're also going to try our best to wring out the solution. Then we're going to go ahead and pack the wound. So we're making sure that we're not touching the wound during this process. We're going to lightly pack the wound. Now that it's packed, I no longer need these, so I will just toss them into the garbage. I can place my 4x4s on. Next, I can just place my abdominal pad. And I can take off my sterile gloves. Perform hand hygiene again.
And now we're gonna start putting everything in our sterile field. So what do I need? I need some scissors for my.
And then we're going to tape the sides of
this. Considering my 1-inch border, we're gonna be touching the very bottom of this, and we're gonna place this into the garbage.
Okay, now we're just going to remove the blunt needle tip, discard this into the sharps, and then clean our area, put the bed back into the lower setting, and yeah, that concludes our video.